The Philippines has reported the first death from the new coronavirus outside of China. Officials in Manila say the 44-year-old man came from the province of Wuhan, the Chinese province hardest hit by the outbreak. The death toll in China has now topped 300. More than 14,000 people have been infected worldwide, almost all of them on the Chinese mainland. As the number of cases there continues to grow, factories have gone into overdrive to meet the demand for medical supplies.
Philippines health authorities said the coronavirus patient had shown signs of recovery but deteriorated quickly. Despite the fatality, officials are urging calm.
All measures needed to contain the spread of the virus is being strictly implemented.
Many countries are now refusing entry to travelers who have recently visited China, against World Health Organization advice. New Zealand is the latest.
Much of this is because simply we do not know. We're in the very early stages of this virus, and there are still things that we're having to learn about the way it's being transmitted. So this is not an announcement that should cause any alarm by New Zealanders. It's precautionary. We're doing it in the best interests of their health.
Countries are airlifting their citizens out of China. A German Air Force plane delivered more than 100 evacuees to Frankfurt. They will spend the next 2 weeks under quarantine in a special facility. And in Indonesia, more than 200 evacuated nationals will be kept isolated on a remote island. Meanwhile, in China, production of medical supplies is being stepped up.
We have not been at home for 7 days and are working overtime to produce disinfectant. I feel glad to contribute to the epidemic control.
Supply lines have become crucial in the effort to contain the coronavirus. In Hebei province, companies are producing hundreds of thousands of medical gloves and surgical masks to support hospitals in Wuhan, the epicenter of the outbreak. And in Guangdong County, workers are busy building makeshift treatment rooms to handle the overflow of newly infected patients. Factories are working day and night to meet demand for medical supplies.
People across the country are concerned about the outbreak in Wuhan. What we ordinary people can do is small. I saw this company recruiting sewing machine operators, and I happen to have such skills because I used to work in the clothing industry. So I immediately came to help.
The number of confirmed cases of the coronavirus has now overtaken the SARS epidemic of 2003.
And for more on this, we go to Matthias Böllinger, our correspondent in Beijing. Matthias, we've seen this jump in both cases and fatalities. People must be getting really worried.
Yes, people are already very worried, so they cannot get very worried anymore. Still, we see few people out on the street. If you look around me, it's a bit more than before because people have tried to stay home for many days now, and today it's a nice day and some people go out, but still it's a lot less than we have seen before. The surge in cases is not really unexpected. We should keep in mind that the incubation period is 7 to 14 days. So the people who are showing up in the hospitals now with symptoms, they're people who have been affected 7, 10 or 14 days ago. And if we remember, that was the time when Wuhan was closed and this chaos broke out in the city. People rushed to the hospitals to get a diagnosis, to get clarity, and people were crammed together in the waiting areas of the hospital, waiting to get tested. And this is probably a moment when the virus spread a lot further. Most of the new cases we are seeing are in Hubei province, the province around Wuhan.
And what new steps are the Chinese authorities taking to get on top of this emergency?
We are seeing now a lot of measures all over the country. One is, we've just seen it in the report, that they're trying to step up the production of medical supplies. They have started to construct makeshift hospitals in Wuhan. They're talking about one makeshift hospital that was constructed in 2003 in Beijing in the SARS crisis, a very similar disease, that they want to put this one back in service. And there are lots of small measures that the party state is taking on every level. Some of them seem to be a bit confused. For example, now everybody who has recently come back into the city has to register no matter where they came from. Delivery services are now stopped at the gate, at least in my compound, and people have to go down to get the deliveries. And also people themselves are taking a lot of measures themselves. Today when I went downstairs, a woman came out of her door with a little disinfectant spray and sprayed the staircase just in case, yeah.
Matthias, if I may, internationally, China has been receiving both praise and criticism for its response to the virus. Why is that? I mean, how do things look on the ground to you?
I think there's little doubt about that China has initially handled this crisis very badly. When the first cases show up, the Wuhan authorities tried to cover it up, allowing it to spread further. They were denying that the virus can spread from human to human when it was already clear, or there were already enough indications that it might do so. So when they finally acted, they threw everything in that they had, but that was already very late. This is the main criticism inside and outside of China.
Okay, Matthias Billinger for us in Beijing. Thanks for that.